The COVID-19 situation has gone from bad to worse. This is a serious cause for concern. The virus is still very active and can penetrate our defenses. And when we think we have found ways to control the virus, it strikes back. That is Dr. V.K. Paul's latest assessment on the pandemic in India. He heads the country's COVID-19 task force. Vaccination remains our best bet to fight the second wave of COVID-19, and the proof is in the US and UK's number, who have immunized a large population and are seeing their case and fatality numbers fall steadily. Everyone above the age of 45 in India can be vaccinated from tomorrow. The center has asked states that are witnessing a sharp surge to achieve 100% vaccination coverage of this age group in surge districts within the next 14 days. For some perspective on the sense of urgency, we began vaccination in January for healthcare and frontline workers, and more than 3 months later, 100% of them have not been vaccinated. We are very much in crisis prevention mode. India's active COVID-19 cases, which were about a lakh less than a month ago, are now at 5.4 lakh. Deaths were around 77 then and have crossed 250 in the last few days. That's a 4- and 5-fold increase in just 3 weeks. The epicenter, like the first time around in 2020, is Maharashtra. 66% of all new cases are from there. 8 out of 10 worst hit districts in India are also in Maharashtra, including Pune and Nagpur, where healthcare facilities are likely to run out of ICU beds and ventilators soon, and Mumbai, where the word lockdown is being passed around in closed-door meetings and a strict night curfew is already in place. Mumbai's healthcare system has begun showing signs of distress. Queues for RT-PCR tests have become longer, with a wait time of between 3 to 4 hours for swab collection. The test reports once again take up to 48 hours to arrive. BMC's war rooms, created last year, have also been reactivated. One of their main purposes will be to allot beds and ventilators centrally. Hospitals can no longer use their discretion to do that in Mumbai. Private hospitals have been asked to reserve 80% of the total hospital beds and 100% of ICU beds for these war rooms. Other states where the second COVID-19 wave has begun rising are Punjab, Chhattisgarh, Madhya Pradesh, Tamil Nadu, Karnataka, Gujarat and Delhi. Some are considering local lockdowns, some are considering containment zones and hotspots, but all have begun taking strict measures to control the spread. For instance, Delhi has begun randomly testing passengers arriving from surge states at the airport. Chhattisgarh has imposed a night curfew. Madhya Pradesh and Uttar Pradesh have closed schools for everyone except high schoolers. Punjab has extended all restrictions till April 10th. The UK strain of the coronavirus, which is more infectious and deadly, has become the dominant strain in Punjab, the Chief Minister said yesterday. And Tamil Nadu has extended its partial lockdown till April end, but no fresh restrictions have been imposed on campaigning. To quote what AIMS director Dr. Randeep Guleria told Indian Express recently, "This is another wave, and it's in our hands how big or small we want it to be and how quickly we want it to end. In many ways, this is the situation we have gotten ourselves into. At our end, we have to follow COVID protocol as fearfully as we did last year. Anything less than that is gross negligence." Experts say the center has to parallelly ramp up vaccination. The move to open vaccination for everyone above 45 from April 1 is expected to increase our coverage significantly. But the private sector has also been urged by the government to pick up pace dramatically. In the 1 month since the private hospitals have been allowed to immunize people for COVID-19, they have accounted for less than 17% of total vaccinations. Before I end, I have one quick international update for you. Canada has temporarily suspended the use of Oxford AstraZeneca vaccine for those under 55 after a few reports of severe blood clots following vaccination. Germany has done the same for those below the age of 60. Scientists will now examine whether the adverse effects are linked to the vaccine before resuming the trial. But I wouldn't panic just yet. Since the vaccine was found safe and effective, it has been no stranger to controversies. First, it was about dosage frequencies, then about how effective it was in adults. Then, for a large part of March, dozens of EU countries suspended its use after reports of a tiny percentage of people developing blood clots. The vaccine was ultimately given a safety green flag by the WHO and the European Medicines Agency, and immunization resumed. All this has significantly impacted people's willingness to take the vaccine, though. A recent YouGov poll across Europe found that 61% of people in Spain no longer trusted the AstraZeneca shot. Italy and France also saw a 27-point rise in distrust of the vaccine. Now, no similar increase in vaccine hesitancy has been noticed for rival vaccines such as Moderna's or Pfizer's. Remember, AstraZeneca's vaccine is the cheapest, it's the most familiar, it's the easiest to store, and among the first choices of all countries across the world, including India, the US, and the WHO's Global Vaccine Alliance. I'll stop here for today. My name is Pallavi Prasad. Thank you for listening.